Hello everyone, this is Rida Harbi, and today we will give you a quick orientation about MRCS OSCE and how to get on board. Who are we? Actually, we are a group of surgeons dedicated to give you the best practice and the tips and the tricks of MRCS, Part A and B. And our message is to get you on board as a competent registrar. Our course outline and mapping, actually, we have will orient you about the number of stations, and we have about 3 anatomy and 2 pathology and 3 critical care scenarios each exam, and this is called knowledge. And in the beginning of the exam, you will be divided into 2 groups. One group will have these stations of knowledge, and the other group will have the skills, which are 2 procedure skills and 4 communication skills. Actually, they are 2 communication skills, but you will get 1 preparatory station for each communication skill. And then history examination, and sometimes you have 2 history always, but sometimes you have 3 examination skills. So 3 anatomy, 2 pathology, and 3 critical care for knowledge. And this is the way the knowledge works, is that if it's in anatomy, you will just go in, spend 9 minutes asking you about 20 questions. And as I said before, you should be quick, brief, and concise, and give what is important in the answer. Don't try use actually, basically, and these are filler words that will waste your time. Then you have, in the critical care, you have 1 minute before you enter to read the scenario, and then you enter. And for each of these sections, there are ways to answer. Again, anatomy, pathology, critical care, and then you have skills. 2 history taking, sometimes 3 examination skills, 2 procedure skills, and 4 communication. 2 communication skills and 2 preparatory for them. And this will give you this in details when you are in our course. Then the way the anatomy works is that you will go in for the anatomy, and you have 9 minutes to answer about 18 to 20 questions. And it's very systematic. The Royal College organized this for you to be systematic in thinking. So you have a bone, and this bone is to just enumerate this bone and then articulate it with the other one to make a joint. What type of the joint, what structures of this joint, and what are the composing elements around this joint, why it is stable joint or unstable joint, and give us a region, for example, quadrangular space, triangular space, to enumerate the boundaries, contents, and any surgical applied questions will be asked there. And then you have the build-up of group of muscles. So you have to know each origin and insertion, especially the pictures which containing compartments. So the arrangement of muscles are important. Short, long, major or minor muscle, they are all important. And then in anatomy, you will have built up after these muscles, grouping of muscles or compartments, and then applied surgical, vascular or neurological injury, nerve injury or vessel injury, and the arrangement when you do, for example, to do burr hole, and for example to do the, when you do the subarachnoid injection or you do the lumbar puncture. So you have to know the layers and in each part of the body and the surface anatomy for certain important structures. In pathology, you have to be oriented about all important definitions in general pathology. And if you go back to this mid-school exams, you will remember what I mean. So this is well structured in our notes. For critical care, always, 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 critical care, they got the lowest marks. And to get the highest marks in critical care, you have to have a structured answer. And this answer is not in any notes in the market. And the promise that there is a certain way to answer a critical care scenario. You need to know. Everyone will say ABCD approach, everyone will say control the bleeding, everyone will say ATLS, CRESP protocols, but not everyone knows how should the structure be to get the highest marks. So you should get the marks for management, professionalism, communication, escalation, support, and all of that. And our new notes are well designed to get you the highest marks in knowledge, especially critical care. So actually, our mock exams and our anatomy exams are related to the questions inside each station, and it will never get changed because actually no one updated the pathway or the course of the median nerve. No one updated the course of the sciatic nerve because it's solid information. It is well fixed or constant information that will not be changed. And this is why anatomy is not that difficult. But don't get yourself stuck in big atlases. You need concise materials made from records, actually. And if you won't have time, of course, great knowledge is for great candidate. So in each answer, you should be concise, brief, and give 1 to 2 sentences answer. And the golden reason is that the examiner will never stop you and say, oh, Harry, we have still some questions to be asked in this 9 minutes. So you should be fast. So the way you study should be like this: brief with mnemonics, and all your answers should be to the point so that you have a complete approach to the exam, and you will miss some points. But don't worry, all your points will not be counted for each station. For example, if you have 5 points in one station, that is not gonna fail you. But what is going to make you fail is that you think that you made this station bad and you are going to do the next one bad. So 3 or more stations are going to fail us, unfortunately. So as I said, you should have concise notes and to the point questions, and you should be on board. When I ask you, you know the answer already. You don't want to search for it in your brain and try to rehearse it. No, you should be ready always. So as I said, you should be organized and to the point, okay? So you shouldn't waste time. You should be concise, brief, and to the point. And actually, the value of our notes is that it gets you on board with brief examination skills, brief history taking, and schematic approach for each station, so that you know what are you going to do. It's not your first time, it's not your second time, but you have notes that is going to help you in all your exams. For example, if I say do lymphadenopathy, you know what are the steps of doing lymphadenopathy. What is the stem? What is the patient actor? Is he real patient? And you are going to do it like this. And you should be ready to be asked about the common and uncommon differential diagnosis for each and the investigations. So again, please be ready for the MRCS OSCE and never waste your time in reading a lot of unnecessary stuff. You should, yes, of course, read, of course, be open-minded, blah, 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 but you should be targeted and to the point study. Don't waste your time and think that the exam will be complex. The exam is easy than you imagine. You need to know the stems and how they are going to be. Thank you so much, and we'll continue for this live orientation next time. And I posted last time, but it wasn't precise because we have a lot of hands-on this year, and we are organizing for Cairo, India, Manchester, and we need you to enjoy our next course. Thank you so much.